Hi everyone, Dr. Soni here. What's the best way to inject the masseter muscle? Inject it with botulinum toxin. Now there are two ways you can inject the masseter muscle. They're called either a single injection point technique or SIT or a multi-injection point technique. There was a paper published in 2018 that basically compared these two different types of techniques to determine if one was better or not. And the conclusion they came to was a single injection point technique produced similar results to a multiple injection point technique. And the study was based on a non-inferiority design, meaning that all they were looking for is to make sure that the two techniques were comparable. They weren't looking to establish whether one technique was better than the other. They just wanted to prove that one technique wasn't worse than the other. And hence, in my practice, I use a single point technique. I've done it that way for the last couple of years because it's a lot easier just to inject someone in one location as opposed to two locations. The study demonstrated that the outcomes in visual improvement and appearance and the global aesthetic scale were similar amongst the two groups. So the best way to inject a single injection point technique, as you can see on this patient up here, is I tend to go at the point of maximum bulge. Easy way to do this is to really kind of define the borders on the top and bottom of the masseter, so right underneath the zygomatic arch and the mandibular bone, and anteriorly you can palpate the masseter, and posteriorly it's the ramus. And so when you draw that rectangle, you want to be somewhere in the middle to slightly inferior posterior at the point of maximum bulging.